Social determinants play a huge role in the overall health of the general public. Deputy Assistant Secretary for Health and Director of the Office of Disease Prevention and Health Promotion, Dr. Paul Reed, discusses the initiative Healthy People 2030. Thanks for your time this morning.
It is my pleasure to be here.
Let's talk a little bit about what you feel are some of the most pressing public health issues at the moment and how your office is working to tackle those.
Well, frankly, I think it's what it's always been, or has been for many decades now, and that is the burden of chronic disease we know in this country. I know that sounds strange at a time of a pandemic, at a time when substance use disorder and overdoses are at a peak, and many other public health related issues are ongoing. But if you really take it in total, if you really look hard at the data that, in terms of where the greatest burden of disease is in terms of morbidity, illness, hospitalization rates, as well as deaths in this country, it undoubtedly we can't avoid talking about chronic disease.
The theme of this year's annual meeting is leading the path toward equity. What has your office done to try to create a healthier nation, leading the path toward health equity, and also addressing some of those health disparities?
For our office in particular, health equity permeates everything we do, from the physical activity guidelines for Americans to the dietary guidelines for Americans, and of course, Healthy People. Healthy People in its 40-year plus legacy has incorporated elements of health equity each and every decade. This decade, far more so than ever before. And that's particularly borne out in the way the social determinants of health are reflected in the work that's presented in Healthy People. The objectives, the data, the resources tied to them, et cetera.
What are some of the efforts that we can look forward to seeing your office lead in the next few years?
So we're in this 5-year cycle of the Dietary Guidelines for Americans. Our office leads. We co-lead it with the USDA, but we have the predominant role to play in administering that, and that includes the Scientific Advisory Committee, which is currently being seated. And we're just starting off the scientific review process coming into calendar year 23. That's a good example. In terms of Healthy People 2030 in particular, we're going to be advancing the data that is incorporated into it. We're going to be adding 2 objectives as the work groups and the public deem appropriate. We're actually currently going through a public comment period on a new objective related to voting participation as an indicator for health. That's another very prominent public health issue these days, civic participation.
You mentioned how broad the social determinants of health are. Can we narrow that down a little bit? Is there a way that you can list maybe some of the social determinants that we need to work on to eliminate so that we can try to eliminate health disparities?
Sure. Well, so the social determinants of health framework has 5 major components to it. One example would be healthcare quality and access. That's one that we think about a lot. In fact, if you look at it, our healthcare system as a whole, it's the lion's share of the focus that we pay to social determinants. It's really on accessing healthcare properly. I would argue strongly that that's probably the least of the 5 that we ought to be paying most attention to. We ought to be looking at housing. We ought to be looking at education. We ought to be directing our attention to where people live, learn, work, play, worship, and age, like we like to say.
Awesome. All right, Dr. Paul Reed, thank you so much for all that you do, and thank you for your time this morning.
It's been a pleasure. Thank you.